Hello juniors, continuing the series of upper limb, we were covering the topic shoulder joint, and in previous video we completed general anatomy of shoulder joint, ligament supporting the joints. So these were the ligaments we did in previous video. Now in today's video we are going to cover bursae related to shoulder joint, relations of the joint in sagittal section, and atrial supply, nerve supply and movements of the joint. So bursae related to the joint. What is bursa? A fluid-filled sac, specially for countering friction. Let me show you a picture. And these are not typical bursa, but these are the implants. But through the help of this image, I was trying to show you fluid-filled sac. These are fluid-filled sacs. These are not bursa. These are implants for human body, like breast implant or else. So what are bursa? Bursa is a fluid-filled sac, especially for countering friction. So these bursa are present in between the joints or in between the muscles, which help in countering friction. There are majorly three bursas present in the shoulder joint. Would like to show you through the help of this. These are the bursas present in the shoulder joint. Can you see? So our first one is the subacromial subdeltoid bursa. This is our subdeltoid bursa. As the name suggests, subdeltoid. Sub means beneath and deltoid means muscle, deltoid muscle. This is present beneath the deltoid muscle, hence named subdeltoid bursa. Subacromial bursa, again as the name suggests, sub means beneath and acromial is the acromial process of scapula. This is the subacromial bursa. Now the second one, subscapularis bursa. This is the subscapularis bursa. It is present beneath the scapularis muscle. Where is this present? It is present beneath the subscapularis muscle. Communicate with the joint cavity. What it does, the fluid communicate with the cavity of joint. We have already studied what is a synovial joint and what are the synovial fluid. So this bursa communicate with the joint cavity. And we have the third one, the infraspinatus bursa. Actually this bursa is not shown in this app. Infraspinatus bursa is present over here. Infraspinatus bursa, name suggests infraspinatus, present beneath the infraspinatus muscle. So this bursa is present beneath the infraspinatus muscle, and this also communicate with joint cavity. So what are the bursas? This is subdeltoid bursa, subacromial bursa, subscapularis bursa, and the last one is present here, the infraspinatus bursa. Here is the point to remember. The subacromial and subdeltoid bursa are commonly continuous with each other but may be separate. So the bursas were subdeltoid and subacromial bursa. They both are commonly continuous. They both are commonly continuous and commonly known as subdeltoid bursa. Both are commonly continuous and both together are known as subdeltoid bursa, but may be separate. So done with the topic bursa related to the joint. Here we have the next topic, relations of joint in sagittal section. So this subtopic under the shoulder joint is the most important topic from university exam point of view. Generally the sagittal section, and to describe the sagittal section of shoulder joint is asked in university exams. Showing you what is sagittal section. This is the sagittal section of shoulder joint. Showing you with the help of so we are viewing this section from here. This corresponds to our sagittal section of shoulder joint. This is shoulder joint and this is sagittal section of shoulder joint. From here we will see this will be our sagittal section. This is anterior side, posterior side, superior and inferior. Anterior, posterior, superior, inferior. Once again showing you with the help of my model. This is the model. If I take out this right now it won't be possible. If I take out this arm and view from this side, that would be sagittal section of shoulder joint. So this was our sagittal section of shoulder joint. So one by one we will see the relations of shoulder joint from superior aspect, anterior, inferior, posterior. So firstly superior. Superiorly there is present the coracoacromial arch, subacromial bursa, supraspinatus muscle and deltoid muscle. This was the main center shoulder joint, glenoid cavity and capsule of shoulder joint depicted from blue color. Now superiorly is the coracoacromial arch. You must have remembered, I have already taught you the coracoacromial arch. This is the arch. This arch represents the coracoacromial arch, which constitute coracoid process, acromion process and coracoacromial ligament. These three all together forms the coracoacromial arch. You can see these are present superior to the joint, shoulder joint, glenohumeral joint. Second one is the subacromial bursa. This is the subacromial bursa. Why it is named subacromial bursa? It is present below the acromion process, and we have seen right before the subacromial bursa. So this is subacromial bursa. Supraspinatus and deltoid muscle. So in superior section we have two muscles, supraspinatus muscle and deltoid muscle. This is our supraspinatus muscle. And here is the deltoid muscle. Deltoid muscle is present both in anterior and posterior and protrudes upward. Both the anterior fiber of deltoid muscle and posterior fiber of deltoid muscles protrudes upward, and therefore they are present in relation superior to the shoulder joint. This is deltoid muscle. You can see they are coming upwards, making an superior relation with the shoulder joint. So we have coracoacromial arch, subacromial bursa, supraspinatus and deltoid muscles. Next is inferiorly. Inferiorly we have long head of tricep, axillary nerve, posterior circumflex humeral artery. This is long head of tricep. You can see from the diagram it is present in the inferior relation. Long head of tricep, axillary nerve and posterior circumflex humeral artery. Posterior circumflex humeral artery is a branch of axillary artery. We have already discussed in the topic axillary artery. So here you can see there is nothing to learn. You can just practice twice or thrice this diagram, and whatever you can see in this diagram you can write it down. So there is nothing to learn. You just have to practice this diagram. Anteriorly we have subscapularis, coracobrachialis, short head of bicep and deltoid. So anteriorly we have 4 muscles. 1, 2, 3, 4. Subscapularis, coracobrachialis, bicep brachii and deltoid. Showing you here only. So this is our anterior relation. Once again showing you from what view we are viewing this sagittal section. So we are viewing this sagittal section from this way. So this was our anterior. Superior, inferior, anterior, posterior. Here is the subscapularis muscle. Anterior relation, subscapularis. Bicep and coracobrachialis. This is bicep and coracobrachialis. And the most outwards is the deltoid muscle. Most anterior is the deltoid muscle. These are anterior fiber of deltoid muscle. Posteriorly we have infraspinatus, teres minor and deltoid. We have infraspinatus, teres minor and again deltoid. Posteriorly infraspinatus, teres minor and deltoid. We are done with superior, inferior, anterior and posterior. Now within the joint we will see what are the components present within the joint. These are tendon of long head of bicep brachii. So here within the joint we have this tendon. This tendon is of long head of bicep brachii. Within the joint we have tendon of long head of bicep brachii. So we are done with the topics bursa related to shoulder joint and relations of the joint in sagittal section. This relation of the joint in sagittal section is the most important subtopic under the shoulder joint. Once if you leave the topic bursa related to shoulder joint general anatomy, it would be okay, but leaving this topic would be very harmful for you. So I truly recommend you to get this topic done, sagittal section of shoulder joint. Now we have to cover the topic atrial supply, nerve supply and movements. Atrial supply and nerve supply of the joint. What are the blood supply of the joint? We have posterior circumflex humeral artery, anterior circumflex humeral artery, suprascapular vessels and subscapular vessels. This is the axillary artery and the branches of axillary artery. Anterior circumflex humeral artery, this is the anterior circumflex humeral artery, and this is the posterior circumflex humeral artery. These both are the branches of axillary artery we have already covered in the topic axillary artery. Now subscapular vessels. Suprascapular and subscapular vessels. We have this suprascapular nerve and suprascapular vessels. Vessels here means both artery and vein. Vessels here mean artery plus vein. So we have suprascapular arteries and veins and subscapular vessels. Subscapular vessels are not depicted in this diagram. So subscapular vessels are in this route. Present right here is the subscapular vessels. These are same as here shown. So we have posterior circumflex humeral artery, anterior circumflex humeral artery, suprascapular vessels and subscapular vessels. Supra here means above and scapular means scapula. So above the scapula, vessels above the scapula are suprascapular and vessels below the scapula are subscapular vessels. Here we have the mnemonic to learn PASS, pass. So with the help of mnemonic, it would be easy for you to learn the blood supply of shoulder joint. Now supply, we have suprascapular nerve as shown you. This is the suprascapular nerve, axillary nerve and muscular cutaneous nerve. These two are the branches of brachial plexus. Already taught you in the topic brachial plexus. Both are the branches of brachial plexus. So for this nerve supply, I have the mnemonic SAM, S-A-M. S stands for suprascapular nerve, A for axillary nerve, and M for muscular cutaneous nerve. Done with the topic blood supply and nerve supply of joint, we have the next topic as movements of the shoulder joint. Movements is also an crucial topic from exam point of view. So there are mainly these movements which I have written here of shoulder joint. Shoulder joint, as I have told you earlier, is most flexible joint and yet most unsafe type of joint. So what are the movements? Flexion, extension, showing you with the help of this image. This is flexion, extension. Abduction is moving the arm away from the trunk is the abduction, and moving the arm towards the trunk is adduction. Medial rotation and lateral rotation, and circumduction, movement in circular direction, is the circumduction. So we are showing you with the help of this model. This is shoulder joint and movement. First, flexion. This would be our flexion. This is flexion type, and moving backwards is the extension. This is extension. I treat her like my ex. This was flexion and backwards was extension. Adduction told you movement of arm towards the trunk is adduction, and movement of arm away from the trunk is abduction. Towards the trunk is adduction, away from the trunk is abduction. Medial and lateral rotation. Medial and lateral rotation is best showed by flexing the arm and in this way. By flexing the forearm and like this. This is the medial rotation towards the center line, and this is lateral rotation away from the center line. And lastly, the circumduction, the whole circular movement of shoulder joint corresponds to circumduction. Hope you might have understood. The movements of shoulder joint: flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction. Here you must have noticed I have made a star on abduction, underlined abduction and made a star on it. So there is an important topic related to abduction of shoulder joint. As I have told you, abduction is the movement of arm away from the trunk. So abduction is classified into three types in 3 degrees of movement. So when this is the arm, this is our dummy, and these are 3 degrees. So when the arm is abducted from 0 to 15 degree, from 0 to 15 degree, the muscle involved is supraspinatus. From 0 to 15 degree, muscle involved is supraspinatus. From 15 to 19 degree, from here to here, the muscle involved is deltoid muscle. From 15 to 19 degree, deltoid muscle. And from 90 to 180 degree, 15 to 90, and from 90 to 180 degree, we have 2 muscles involved: trapezius and serratus anterior. So from 0 to 15 degree, supraspinatus, 15 to 90 degree deltoid, and 90 to 180 degree we have the muscles involved in the abduction is trapezius and serratus anterior. So this is also an important point to remember in abduction, in movements, abduction. You might have understood the topic. So we are done with atrial supply, nerve supply and movements. So in next video we'll be covering rotator cuff and clinical relation of shoulder joint. Thank you.